been called to a 46-year-old female suffering from headache. Before I entered onto the premises, I checked for scene safety. Hello, I'm Denise from the ambulance. What's your name?
My name is Ina.
Ina, why did you call the ambulance today?
I've got a really bad headache today.
Oh dear, so what were the circumstances? What were you doing when it came on?
I just had breakfast and all of a sudden I felt this headache coming on.
Okay, so was it sudden or was it a slow onset?
I would say it came on slowly.
Slowly. So another question, do you normally suffer from headache?
I get them quite frequently,
okay.
And then I just take some paracetamol and that gets...
Does it feel the normal progression for you?
It started off quite normal,
yes.
And then I took the paracetamol, but that didn't relieve it at all.
Okay, and does the paracetamol normally relieve it?
Yes.
Okay, a few basic questions. What medications are you on?
Oh, I've got this note from my doctor. I'm taking warfarin, Betaloc and omeprazole.
Okay, so the reason you're taking those medications is because?
I had a TIA about 3 years ago and then the doctor put me on these.
Okay, nice. And your past medical history other than the TIA, have you got any
No, not that I'm aware of, no.
So no vascular disease with you or your family?
No.
What about head bleeds of any kind?
No, not that I'm aware of.
Or even in your family?
No.
Have you suffered trauma lately at all?
No.
What about feeling ill? Are you feeling
No, I'm feeling quite okay.
Okay. So no symptoms of pneumonia or influenza or anything like that?
No.
Okay, great. Have you been vomiting at all?
No, I'm okay.
And these you wouldn't class. Have you ever had migraines at all?
No, I wouldn't call them migraines.
The last question, are you pregnant?
No, I don't think so.
No, you're not pregnant. Okay, great. So what I would like to do now is take a set of vital signs.
Sure.
Okay. Have you got any drug allergies?
Not that I'm aware of, no.
Okay. So no drug allergies. And you told me your medications. You have no significant past medical history other than your TIA. And I'll take a set of vital signs to see if they're normal. Do you know what your blood pressure is normally?
I've been to the doctor about 3 weeks ago and it was 130 over 70.
Okay. All right. So she's saturating at 99% with a pulse of 80. She's got a blood pressure of 125 over 70, which is all normal, within the normal range. The last vital sign I'm going to take is the temperature. Do you mind if I pop this?
No, that's fine. Go ahead.
36.7, so that's normal too. Great. Would you mind if I touched your head and just felt to see if you have anything?
No, that's fine. You can go ahead with it.
It's very important as paramedics that we get permission to touch our patients, especially in some ethnicities they don't like their heads touched. So it's very important that we gain their permission. We good to go?
That's fine.
Excellent. Is it sensitive in any way, even when I'm touching?
No, that's all good.
Okay, put it back down and see there.
No, that's fine.
Okay, working towards the middle of your spine. Any sensitivity or altered sensation?
No, that's all good.
Great. If you look at me, do you see double vision or any blurred vision?
No.
None. Are you hearing normally?
Yes. No changes.
Okay. And no altered sense of smell or anything like
No,
that?
no, that's all fine.
I think this patient has a GCS of 15 and her vital signs are all normal. She has no previous history of intracranial bleeds or illness of any kind. She's not pregnant, she hasn't suffered trauma, she hasn't been vomiting, she's not ill in any way. It wasn't a sudden onset, so it's a normal progression of this headache. The only reason I would like to take you to hospital is because you're on warfarin. And for us, that's an indication that you need to be transported, just in case there's a problem that is brewing. Are you comfortable with that?
Yes.
Excellent. So my crew partner will help you into the ambulance, and they will give you some pain relief. So you've taken paracetamol an hour ago.
Yes.
So I won't be giving you any more paracetamol, but I'd like to give you some ibuprofen and tramadol, provided that none of the contraindications apply, and we might give you some opiate analgesia as well. Okay?
Thank you.
Excellent. Thank you.